Welcome to the State of Wisconsin Department of Workforce Development Trade Adjustment Assistance Program, or TAA. In this video, we'll be talking about healthcare. Loss of a job usually includes loss of healthcare coverage, creating one more problem for you to solve. The Health Coverage Tax Credit Benefit, or HCTC, is a benefit offered through the IRS. It can lighten the burden of paying your health insurance premiums.
A lot of times when a worker loses their job, their health insurance is more important to them than their paycheck. So Health Coverage Tax Credit is one of the benefits of the Trade Adjustment Assistance Program, and that can help a person afford a substantial amount of their health insurance premium for a qualified health plan.
To be clear, HCTC isn't health insurance, but it does pay most of the premium on your own health insurance. 72.5% of it. You can choose to receive this benefit as a yearly tax credit or as monthly payments directly to your health insurance provider. If you choose the yearly tax credit, you pay all health insurance premiums on your own throughout the year. Then you receive 72.5% of your premiums back as a tax refund at the end of the year, or to reduce what you owe on your federal tax return. If you choose the monthly assistance option, you would pay your 27.5% each month directly to the IRS. They then contribute the remaining 72.5% and pay the insurance premium for you. The tax credit or monthly assistance can be applied to any qualified health plan where you or your spouse is paying more than half the premium. Qualified health plans include COBRA coverage through your former employer, a spouse's health plan, or private sector coverage. First, let's look at COBRA. COBRA is an extension of your company-provided health plan that's offered after you leave the company. You may still have access to your company's health plan through COBRA, but the company's contribution to it usually shrinks or disappears once you're laid off. HCTC brings the cost back down and helps you afford COBRA coverage. If you already turned COBRA down because of the cost, you may have a second chance. Becoming eligible for TAA benefits begins a new 60-day window to choose COBRA. An important note, COBRA is through your company, not through TAA. So this isn't something your career planner can assist with. You'll have to contact your company's health plan administrator to choose COBRA. If you have questions about how this works, the IRS can give you more information. Moving on from the COBRA option, the second type of qualified plan is your spouse's health plan. Loss of your job is a qualifying event that allows you to join it. Your spouse's health plan administrator has information on steps you need to take to move yourself and your family members over. The third qualified plan option would be private sector coverage. This is insurance you purchase through a private insurance company or broker.
It's a tax credit that a person may be eligible for, but it is administered by the IRS, and so an individual who's interested would have to make application through their website.
What if you have a plan that you bought on healthcare.gov? These plans aren't eligible because they already have a cost reduction formula applied. Who's eligible for HCTC? Anyone who's actively participating in the TAA program and receiving UI, TRA, or RTAA weekly allowances is able to claim the HCTC yearly tax credit or the monthly payment assistance. You can receive the HCTC benefit for every month you receive at least one of these payments from UI, TRA, or RTAA. To begin receiving HCTC, apply online at www.irs.gov for the monthly payment assistance option, or take the yearly tax credit option when you file your annual tax return.
I have an individual right now who, had it not been for health coverage tax credit, he would not have been able to pursue training to afford himself greater career opportunities because he was his family's breadwinner and his family's insurance provider. So he was able to work with an agent with the benefit of health coverage tax credit to afford the premiums for a family of 4 while he's going through this transition.
Let's review the key takeaways for HCTC health insurance assistance. You have to apply for TAA benefits first and begin receiving at least one payment or allowance. Then enroll in a qualified health plan. Now you can apply for HCTC for monthly assistance or plan to claim it on your annual tax return. Work with a TAA career planner, either at an orientation session or over the phone to get started with TAA benefits. We look forward to helping you succeed.